Hi, today I'm going to present about neglected tropical disease known as NTD in Nigeria. This is Program Coordinator Yunhwa Lee from Healthyi. It's an agenda for this presentation and I will just skip this. First of all, what is NTD? NTD is a group of parasitic and bacterial infections in tropical and subtropical regions, particularly in low-income countries affecting more than 1 billion poor people and people with limited access to healthcare worldwide. These are the common NTDs and their treatments. I'll just go over the most common one in Nigeria, which is malaria. It spreads by mosquitoes and has a high prevalence in tropics. Specifically, more than 80% occurs in Africa. It also has a high mortality, which is more than 400,000 deaths per year. Its treatment is anti-malarial drugs. Young children are more likely to be exposed to these kind of NTDs because of their weak immune systems and vulnerable constitution. Next is the basic information about Nigeria. It's located in Atlantic West Africa and its population is about 216.74 million in 2022, which is the highest population in Africa. It is generally very hot all over the year. Of the world's population, approximately 100 million people are at risk of having at least one of the NTDs, and millions of people are infected with one or more. As I said in the previous slide, Nigeria is a country with a high prevalence of NTD, as a quarter of people affected by NTD in Africa living in Nigeria. The reasons for this are huge population, economic disparity, weak infrastructure, poverty, and underdeveloped health systems. Therefore, the Nigerian government and international organizations are working together to overcome and prevent this situation. Programs and campaigns for prevention and treatment are being implemented already. Next is statistics. 16% of Nigeria's population is children, of 51% is boys, and the rest of it is girls. This pie graph shows the proportion of boys and girls out of school or in school. As you can see, more than half of them are not being educated properly at school. These are the data from WISE program showing reasons for having never attended school and for dropping out of school. These two bar graphs show that most of the out-of-school students are poor. I can infer that most Nigerian students cannot receive their education due to their severe poverty. Lastly, I'm going to talk about the impact of NTD in Nigeria. First, domestic influence. NTD causes serious illness, mortality, and disability, and impacts significantly economic and social consequences for affected communities. So the global burden of NTD is enormous, and the impact on human health and development is important. NTD obstacles in affected countries are poverty and economic situation. This is because of perpetuating the cycle of poverty by primarily affecting marginalized populations. Children's obstacle is a lack of education. Often absent from school results in poor educational attainment and limited opportunities. Therefore, this cycle exacerbates the burden of disease. Next is international influence. The impact of NTD has important social as well as health and economic outcomes. In many affected communities, NTDs are stigmatized, leading to discrimination and marginalization of affected individuals. The social stigma associated with NTDs can also limit access to health care and negatively impact mental health. NTD's international impact is not limited to affected countries. This disease could also have a global impact, affecting trade and tourism and posing a threat to global health security. Possible solutions for NTDs are preventive measures, such as improved sanitation and the mass drug administration program to provide prophylactic chemotherapy to people at risk, more access to healthcare and education. WHO developed a roadmap for the control and elimination of NTDs. It made a significant progress in reducing the prevalence of some of these diseases. As a result, it increased awareness of the importance of addressing NTDs in recent years. In the future, addressing the burden of NTD requires a comprehensive approach that includes preventive measures, access to health education, and international cooperation. By working together to address NTD, we can improve the lives of millions of people around the world. This is the end of my presentation, and thank you for listening.